Did you know that celebrities can save lives even after they're gone? Have you ever wondered how a famous person's death could actually help millions of others? Number 10. Anthony Bourdain, mental health awareness. What happens when someone who seems to have it all takes their own life? When Anthony Bourdain died by suicide in 2018, the world collectively gasped. The celebrity chef, author, and television personality was 61 years old and at the height of his career. His CNN show, Parts Unknown, was beloved globally. He traveled to exotic places, ate amazing food, and connected with people from all walks of life. From the outside, his life looked perfect. Bourdain's death sent shockwaves through not just the culinary world but society at large. Here was a man who had overcome addiction earlier in his life, who spoke openly about his past struggles, who seemed to have found his purpose. His death forced a conversation about depression and how it can affect anyone, regardless of fame, fortune, or apparent success. In the days following Bourdain's death, calls to suicide prevention hotlines increased dramatically. The National Suicide Prevention Lifeline reported a 25% increase in call volume in the days after his death. Mental health professionals used this moment to emphasize that depression doesn't discriminate and can affect people who outwardly appear to be thriving. Organizations dedicated to mental health used the increased attention to push for more resources and to reduce the stigma around seeking help. Bourdain's death helped highlight that mental health issues aren't always visible and that someone can be suffering even when they seem fine to the outside world. Several years later, the conversations sparked by Bourdain's death continue to resonate. Restaurants and kitchens, traditionally high-stress environments where substance abuse and mental health issues have been common, started implementing wellness programs and resources for staff. The tough-it-out culture began to shift toward one where asking for help is seen as a sign of strength, not weakness. Number 9. Chadwick Boseman, colon cancer awareness. Do you check your body for warning signs? When Chadwick Boseman died of colon cancer in 2020 at just 43 years old, many people were stunned to learn he had been battling the disease for 4 years while filming several blockbuster movies, including Black Panther. Boseman had kept his diagnosis private, continuing to work while undergoing treatments including surgeries and chemotherapy. The revelation of Boseman's illness came as a shock because he was young, physically fit, and showed no public signs of his struggle. His death highlighted an alarming trend. Colorectal cancer rates have been increasing among younger adults. Traditionally considered an older person's disease, colon cancer has been affecting more people under 50 in recent years. Following Boseman's death, medical organizations reported significant increases in people seeking information about colorectal cancer. The Colorectal Cancer Alliance saw a 9,500% increase in website traffic and a surge in young people contacting them about screening options. Many doctors began reporting what they called the Chadwick Boseman effect, an increase in younger patients requesting colonoscopies and asking about symptoms. The American Cancer Society had already lowered its recommended age for colorectal cancer screening from 50 to 45 in 2018, but Boseman's death at an even younger age emphasized the importance of knowing family history and recognizing symptoms regardless of age. His passing particularly resonated in the Black community, where colorectal cancer rates are higher than in other groups. Boseman's legacy extends beyond his iconic film roles to include raising awareness about a disease that is highly treatable when caught early. His death reminded the public that cancer doesn't care about age, race, or fame, and that paying attention to changes in your body could save your life. Number 8. Carrie Fisher, heart disease in women. Can a princess help save hearts? When Carrie Fisher died in 2016 at age 60 after suffering a cardiac event on a flight from London to Los Angeles, her fans around the world mourned the loss of the beloved Star Wars actress. What many didn't realize was how her death would shine a spotlight on heart disease in women, a condition often overlooked and underdiagnosed. Fisher, known worldwide as Princess Leia, suffered a cardiac arrest on the plane and died 4 days later. The medical examiner determined she had a buildup of fatty tissue in her arteries. Her death highlighted several important aspects of heart disease. It remains the leading cause of death for women in the United States. Women's symptoms often differ from men's, and women are frequently misdiagnosed or diagnosed later than men. Following Fisher's death, cardiologists reported an uptick in female patients seeking information about heart health. The American Heart Association used the opportunity to educate the public about how heart attack symptoms can present differently in women. While men typically experience crushing chest pain, women might have subtler symptoms like fatigue, shortness of breath, nausea, or pain in the jaw, neck, or back. Fisher was open throughout her life about her struggles with bipolar disorder and substance abuse. These conditions, along with the medications used to treat them, can increase the risk of heart problems. Her death highlighted the complex interplay between mental and physical health and how treating one condition can sometimes affect another. The conversation around Fisher's death also addressed the stress of celebrity, aging in the public eye, and the pressures women face. In her typical candid style, Fisher had spoken about the film industry's focus on appearance and the stress of feeling obligated to lose weight for her return to the Star Wars franchise. This pressure and stress may have contributed to her heart condition, bringing attention to how chronic stress affects cardiovascular health. Number 7. Rock Hudson AIDS awareness. Could one man change how we view an epidemic? When Rock Hudson died of AIDS-related complications in 1985, he became the first major celebrity to succumb to the disease. The handsome leading man had starred in dozens of films opposite actresses like Doris Day and Elizabeth Taylor, embodying a certain ideal of American masculinity. His death from a disease that was then heavily stigmatized and associated with gay men forced America to confront the realities of the AIDS crisis. Before Hudson's diagnosis became public, AIDS was often dismissed as a gay plague or a problem affecting only certain marginalized communities. Many Americans believed they weren't at risk. Hudson's illness put a familiar, beloved face on the disease. Suddenly, AIDS wasn't something that happened to other people. It had struck someone millions of Americans had welcomed into their living rooms through films and television. The impact was immediate. Media coverage of AIDS increased dramatically after Hudson's announcement that he had the disease. His friend and former co-star Elizabeth Taylor became one of the first major celebrities to advocate for AIDS research and treatment, helping to found the American Foundation for AIDS Research, AMFAR. President Ronald Reagan, who had not publicly addressed the AIDS crisis despite thousands of deaths, finally mentioned the disease in a public speech several months after Hudson's death. Hudson's legacy includes humanizing AIDS at a time when fear and misinformation were rampant. Public health officials noted increases in funding for research and a greater willingness to discuss prevention after his death. The revelation that such an iconic, masculine star was both gay and affected by AIDS challenged stereotypes and helped some Americans reconsider their prejudices. In the years following Hudson's death, other celebrities became advocates for AIDS awareness and research. The red ribbon became a symbol of solidarity, and eventually, medical advances transformed HIV from a death sentence into a manageable chronic condition for many people with access to treatment. Hudson's death marked a turning point in public consciousness about the disease, helping to pave the way for these changes. Number 6. Michael Jackson prescription drug abuse. What happens when the medicine cabinet becomes more dangerous than the street corner? When Michael Jackson died in 2009 from an overdose of propofol and benzodiazepines, the world lost a musical genius and gained a harsh lesson about prescription drug abuse. The King of Pop's death at age 50 highlighted the dangers of medication misuse and the complex relationships between celebrities, doctors, and pharmaceuticals. Jackson died after his personal physician administered propofol, a powerful anesthetic normally used in hospital settings, to help him sleep. The investigation into his death revealed he had been using various prescription medications, often obtained through multiple doctors. His physician was eventually convicted of involuntary manslaughter for his role in Jackson's death. The very public nature of Jackson's death and the subsequent trial brought unprecedented attention to the issue of prescription drug misuse. The Centers for Disease Control and Prevention had already been tracking an alarming rise in deaths from prescription painkillers, but Jackson's case highlighted how even medications prescribed by doctors could be deadly when used improperly. Health officials used the tragedy to educate the public about the risks of medication interactions, the importance of using prescriptions only as directed, and the dangers of doctor shopping. State pharmacy boards began implementing or strengthening prescription drug monitoring programs to flag potential misuse patterns. Jackson's death also sparked conversations about the pressure celebrities face, the physical toll of performing, and the way chronic pain is treated. He had suffered injuries throughout his career and reportedly used medications to manage pain and sleep issues. His case raised questions about whether fame creates a situation where normal medical standards might be compromised, with doctors possibly prescribing medications to keep celebrity clients happy rather than adhering to best medical practices. Number 5. Brittany Murphy pneumonia and anemia awareness. Could a simple supplement have saved a life? When Brittany Murphy died suddenly in 2009 at age 32, initial reports focused on her dramatic weight loss and rumors of drug use. However, the official cause of death was something far more unexpected: a combination of pneumonia, severe anemia, and multiple drug intoxication from over-the-counter and prescription medications taken to treat a respiratory infection. Murphy, known for her roles in films like Clueless and 8 Mile, had reportedly been suffering from flu-like symptoms in the days before her death. The coroner ruled that while the medications in her system were not illegal and were taken to treat her illness, the combination, along with her weakened state from pneumonia and anemia, proved fatal. Her death drew attention to how seemingly minor health issues can become life-threatening when combined. Pneumonia, often dismissed as just a bad cold, kills more than 50,000 Americans annually. Murphy's case highlighted how vulnerable people can become when their immune systems are already compromised by conditions like anemia, which reduces the blood's ability to carry oxygen throughout the body. Public health officials used Murphy's tragic death to educate people about the importance of seeking medical care for persistent respiratory symptoms and the dangers of self-medicating without understanding potential drug interactions. Iron deficiency anemia, which some reports suggested Murphy suffered from, is relatively common, especially in young women, but can be easily treated when properly diagnosed. The circumstances surrounding Murphy's death also prompted discussions about body image in Hollywood and the extreme pressure actors, particularly women, face to remain thin. Some speculated that Murphy's apparent weight loss might have contributed to her anemia and overall fragility. Her death served as a reminder that drastically restricting food intake can have severe health consequences beyond just appearance. Number 4. Bob Marley skin cancer awareness. Can a small injury kill a legend? When Bob Marley died in 1981 at the age of 36 from acral lentiginous melanoma, a rare form of skin cancer that had started under his toenail, many people were surprised to learn that darker-skinned individuals could develop fatal skin cancer. The reggae icon's death highlighted misconceptions about who is at risk for different types of skin cancer and the importance of having unusual skin changes examined regardless of skin color. Marley's cancer reportedly began as what he thought was a soccer injury, a dark spot under his toenail. When it didn't heal, it was diagnosed as melanoma. He refused amputation of his toe for religious reasons related to his Rastafarian beliefs, and the cancer eventually spread throughout his body. By the time he sought comprehensive treatment, the disease was too advanced. His death raised awareness about acral lentiginous melanoma specifically, which appears on the palms, soles, and under nails. Unlike other forms of melanoma that are strongly linked to sun exposure, acral lentiginous melanoma is not. It's also the most common form of melanoma in people with darker skin tones, though it remains relatively rare overall. Dermatologists and public health officials have used Marley's case to emphasize that everyone, regardless of skin color, should be vigilant about unusual skin changes. While it's true that people with darker skin have more natural protection against UV-related skin cancers, they are not immune and may actually be diagnosed at later stages due to the misconception that they aren't at risk. The conversation around Marley's death has evolved over the decades to address the broader issue of health disparities and how racial and ethnic minorities often receive different levels of healthcare information and access. His legacy includes not just his revolutionary music and messages of peace, but also an important reminder about health vigilance and the need for inclusive public health education. Number 3. Jim Henson Bacterial Pneumonia Awareness. How could a simple sore throat kill the man who gave us Kermit? When Jim Henson, creator of the Muppets, died in 1990 at age 53, the cause was as unexpected as it was tragic: toxic shock syndrome resulting from a severe streptococcal pneumonia infection. Henson had been feeling ill for several days but delayed seeking medical treatment, believing he just had a bad case of the flu. By the time he went to the hospital, the infection had progressed too far. Henson's death shocked the public not just because of his beloved status as the creative genius behind Kermit the Frog, Miss Piggy, and countless other characters, but because it seemed so preventable. He had been in good health, was relatively young, and died from what started as an ordinary sore throat, something most people experience and dismiss multiple times throughout their lives. Public health officials used the tremendous media attention surrounding Henson's death to educate the public about the potential seriousness of streptococcal infections and the importance of seeking medical care when symptoms persist or worsen. Many doctors noted an increase in patients coming in with sore throats in the months following news of Henson's death, referring to it as the Henson effect. His case highlighted how, even in the modern medical era, relatively common bacteria can sometimes overwhelm the body's defenses with devastating speed. It served as a reminder that antibiotics, while sometimes overprescribed, can be life-saving when used appropriately for bacterial infections. Henson's family established the Jim Henson Foundation after his death, and his son Brian has occasionally spoken about the importance of not ignoring persistent symptoms. The lesson from Henson's untimely passing continues to be relevant. Respect your body's warning signs and don't let stoicism or a busy schedule prevent you from seeking medical attention when needed. Number 2. John Ritter Aortic Dissection Awareness. What if a heart attack isn't really a heart attack? When beloved actor John Ritter died suddenly in 2003 on the set of his sitcom 8 Simple Rules, he was initially thought to be having a heart attack. In reality, he was suffering from an aortic dissection, a tear in the inner layer of the aorta, the large blood vessel branching off the heart. The misdiagnosis highlighted how this potentially fatal condition is often confused with more common cardiac problems, delaying crucial treatment. Ritter, known for his role as Jack Tripper on Three's Company, experienced chest pain while working. He was taken to a hospital where doctors treated him for a heart attack. By the time the correct diagnosis was made, it was too late for the emergency surgery that might have saved his life. He died on his daughter's 5th birthday, just days before he would have turned 55. After his death, Ritter's widow, actress Amy Yasbeck, established the John Ritter Foundation for Aortic Health to raise awareness about thoracic aortic disease and the importance of early diagnosis. The foundation supports research and educates both the public and medical professionals about recognizing the symptoms of aortic dissection, which include sudden severe chest or upper back pain, often described as ripping or tearing, shortness of breath, and symptoms similar to those of a heart attack. Medical journals reported what they called the Ritter effect, an increase in correct diagnoses of aortic dissections, as doctors became more aware of the condition following the publicity around Ritter's death. Emergency physicians began considering aortic dissection more frequently in their differential diagnoses for patients presenting with chest pain. Ritter's case also highlighted the potential genetic component of the condition. After his death, his brother was diagnosed with a thoracic aortic aneurysm, a weakening in the aortic wall that can lead to dissection. This led to increased awareness about the importance of screening family members when one person is diagnosed with aortic disease. Number 1. Audrey Hepburn, rare cancer and humanitarian work. Can a star's final act be their most important? When Audrey Hepburn died in 1993 at age 63 from a rare form of abdominal cancer called pseudomyxoma peritoni, she had already established a legacy that extended far beyond her iconic film roles. In her later years, the Breakfast at Tiffany's star had become a dedicated UNICEF ambassador, traveling to some of the world's most troubled regions to advocate for children's rights and draw attention to their suffering. Hepburn's cancer was an unusual type that begins in the appendix and spreads slowly through the abdomen. By the time she was diagnosed, the disease was already advanced. Her illness and death drew attention to this rare form of cancer, which even today remains difficult to detect in its early stages and challenging to treat. What made Hepburn's public health impact unique was how she connected her own experiences with her humanitarian work. Having survived malnutrition as a child in Nazi-occupied Netherlands during World War II, she had a personal understanding of hunger and its effects on children. She used her celebrity status to highlight global malnutrition and the importance of clean water, vaccination, and basic health care for children worldwide. After her death, donations to UNICEF increased significantly, allowing the organization to expand programs providing essential health care to vulnerable children. Medical professionals also noted increased interest in and funding for research into rare cancers like the one that took Hepburn's life. Perhaps most importantly, Hepburn's graceful transition from film star to humanitarian helped establish a model for celebrity activism that continues today. She demonstrated how famous individuals could use their platforms to direct attention to public health crises and motivated many celebrities who followed to take on similar roles. Her final years of service, even as she battled cancer, emphasized the connection between individual health and global public health challenges. As she once said, "As you grow older, you will discover that you have two hands, one for helping yourself, the other for helping others." Did you know that these 10 celebrities may have saved more lives after their deaths than most medical professionals do in their entire careers? Have you ever thought about how your own health vigilance might be influenced by the lessons learned from these tragic losses?